Hello guys, welcome back to our channel. We are the Hillsborough County Young Democrats. Thank you so much for tuning in to another great video. I'm joined with the amazing Jason Marlow. Hey Jason, how are you?
I'm doing good, Quentin. How you doing, buddy?
Hey, I'm great. And I can't remember if I introduced myself, but I'm Quentin Torbert, which I think guys probably know that by now, but I'm so excited about your article. You had a very interesting time getting tested for coronavirus, and so you decided to write an article about it, and so we're here to speak about it. First off, how are you feeling?
Yeah, I'm feeling fine. It's been 10 days, 11 days since my exposure. I had a business meeting, had to take. I mean, it was too important to turn down. We met in an indoor restaurant. Had a conversation with one another across a lengthwise table. I thought we had observed all appropriate social distancing. But the next day, I received a phone call from this person informing me that they had tested positive. So obviously, anxiety, gripped me. I mean, had I been responsible enough? Should I have even been taking a meeting indoors? I mean, I at a certain level, I have to assume personal responsibility for myself. I made the choice to do that, and I put myself potentially at risk. And so, yeah, I was nervous. So my immediate instinct was to try to find a way to get tested. And I had folks who I know who had got tested through CVS, some through the city, some through the county. I had a myriad of recommendations. So my first idea was to go through CVS. My understanding, it was drive-through. You applied the swab yourself. And it was sort of just, like a getting your hamburger, just a COVID test effectively, which, fine. I tried for 2 days to get that done, for hours and hours and hours.
2 days.
And it just did not work. At first, the menus that CVS offers doesn't really effectively cover my reasoning for wanting to get tested. It said, there's no option for have you been exposed and therefore you want to test. Your only option was have you received advice from a medical professional? Are you a caretaker? Are you immunocompromised? If you're one of these subgroups, then, okay, here's the avenue to get tested. But I had not been recommended by a medical professional, though it was pretty obvious, having just been in close contact with someone who had tested positive, that I should get a test.
Yeah.
So telling the truth didn't get me. It said I was ineligible. Ad-libbing and saying a medical professional had given me that advice then opened up the menu for me to then get a test. The problem was they were booked that day, the next day, and the day after that. And those are the only days that they were offering. They were booked, at all 7 locations across Hillsborough County. So we're talking from Ruskin all the way up to Plant City, to West Chase, to Tampa, and all 7 locations booked. So that kind of left me nervous. I tried again, this was a Thursday. I tried again that Friday. I tried again that Saturday. I tried again that Sunday. Nothing. What was worse was the city and the county lines. The city and the county lines were a Kafka-esque nightmare of unending failure. It was call, busy signal, or call dropped. The Thursday I started calling at 7:59. The call lines opened at 8. I spoke to one operator around 8:15, 8:11, who basically said to me that the system was so overwhelmed that if they couldn't put you in the queue, if the queue couldn't take you, the system was going to crash. So they just dropped your call.
Wow.
This was only 11, 15 minutes in, so that was the only person I even got to speak to Thursday, because by the time she tried to forward me to the person to schedule my test, my call was dropped. I called back, busy signal. Just busy signal, busy signal, busy signal. From 7:59 to noon Thursday. On Friday, I didn't even get to speak to a person. 7:59 to noon. Dial tone, busy signal, call drop, nothing. And on Saturdays and Sundays, the city and county lines are both closed. So I'm I'm sweating a little bit over 4 days.
That will make me
Wondering about
because you're trying so hard, and day after day after day, you keep running into roadblocks. That's very frustrating.
Yeah, I mean, it was definitely upsetting. I mean, I'll say that the few people, God, the one human being I interacted with over the whole process, the operator, was extremely professional and trying to do what she could. But yeah, I mean, the logistics of the system has failed us, and it definitely failed me. I mean, I was just really fortunate that I still hadn't shown symptoms, but I was nervous and I was sweating over the weekend. And on Monday, I was on the phones again from about 7:59 to almost 11. It was like nearing 11 when I finally got a hold of a person, and it was a little bit after 11 when I was finally able to schedule my test for 4 days later.
Wow.
So like put that in perspective. So it took me a full week to go from when I called to try to get a test to when I was actually able to get the test.
Wow.
And my concern for that, as I talk about in the piece, and frankly, I probably should have talked about more, I'm really lucky. I work from home right now. I got 2 chihuahuas right here, Layla and Ella, and they're chilling. I don't have to worry about that. I'm not a single parent. I'm not a parent. Like, I can't imagine a person who has to work from an office, or has to deal with their children. I really can't understand who has the collective, let's say 11, 12 hours that I put into over the course of 3 days, 4 days trying to get a test. I don't know how many people have that kind of time. It's very, 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 very concerning, because I just don't know how, if the average person doesn't have that kind of time. This was over the last week. Cases today have crossed 11,000.
They are skyrocketing,
So,
like crazy.
like, what's going to happen as the demand increases? My experience is probably only going to be, significantly worse for those who are calling on Monday.
Yeah.
Those folks are going to have a lot more trouble than I did. That concerns me. That very much concerns me.
One of the troubling things is that Governor DeSantis has been clear that he is not closing down the economy again. And so what happens next? Do we just keep watching the COVID cases go up and up? Or where do we, as Hillsborough County residents, go from here?
I'm not really sure. I'm not really sure where we go. I mean, listen, at a certain point, our safety is going to depend on both leadership and our own personal responsibility. I mean, they go hand in hand. We have to be responsible for ourselves and others, and leadership needs to put out an example and rules and enforcement that ensures people are protecting themselves and one another, because this is the only way we're going to achieve public health and safety at this moment. I mean, like, I don't know, man. I just don't know. Personally, I think the only way we're going to achieve the kind of stagnation we had seen in the virus previously was through some kind of return to stay at home, or some kind of mixed order similar to what we saw in the very beginning of reopening, where there was no indoor seating for restaurants. Folks could be seated outdoors. I think that might be a somewhat sustainable model for the foreseeable future until cases cease to spike. But I'm a really firm believer that it's workplaces, bars, restaurants, even private homes where people are gathering amongst themselves. That's where I believe this infection to be spreading. I think social engagement, like the protest movement, has probably had some contributing factor to it. I don't think it's a critical contributing factor, but we all need to be doing whatever we can to minimize the spread of the pandemic. That's the most important thing here. It's not just about us. It's about taking care of other people.
Especially like people who are most vulnerable, who are people who are older, and also people that have pre-existing conditions. When I'm going to the grocery stores, I consistently see young people not wearing masks or not taking precaution. It's kind of annoying because they're younger people, for the most part, they can get sick, they can get the disease, and they'll recover. But what happens to the people that take care of someone who are vulnerable, who are older, who they may be a young person, but they have pre-existing conditions that make them more susceptible to this disease? It's really some people have like an air of unfairness where they think, well, I'm healthy, so I'm going to take no precautions. And that's really, really saddening. Very saddening.
It is. You got to think, I mean, like, man, live by that golden rule. How would you want, treat others as you would want them to treat you? I mean, it's really that simple. If you were a person who had some kind of sincere immunocompromisation, how would you want the others around you to behave? You would want them to behave responsibly with your health and safety and well-being in mind. And for people to disregard others, I mean, what is it going to take? Did they have to lose a friend or family member before it becomes personal to them? Because as someone who, I'm very fortunate, I haven't lost anyone, but I know multiple people who have. I know people who have lost their fathers to this. This is not a joke to me, and it shouldn't be a joke to anybody. And I mean, like, when you're playing games with other people's health, it's really gross. Yeah, and that's why I take such issue again with Sabatini be giving a platform by our counterparts, because he's currently suing Orange County for a mask mandate. And so, I mean, if those mandates are not upheld and people decide to not wear masks because there's no enforcement, now what happens? The virus continues to spread. In Orange County alone, there were 2,000 new cases. 2,000 new cases. So you're putting literally people at risk. And I find that detestable. And we need leaders who will take people as something that's more important than profit or ideology. And that seems to be something that's severely lacking on the GOP. I'll give credit where credit is due. There have been some GOP governors in a number of states and other GOP elected leaders who have seen fit to, compel people or, beg people, frankly, to wear masks. Credit where credit is due. But we need this to be a universal thing. This has nothing to do with your partisanship. It has everything to do with being a responsible person who cares about the well-being of others.
I love that, man. That's it. What else do you have in conclusion? What final closing remarks do you have?
So I end with wear your damn mask. Wash your hands. Socially distance. Stay at home where possible. Treat others as you would want them to treat you. And stay safe. Take care of yourself. Be well. And that includes you, my good friend.
You too. You stay home. I know you're already at home, but just keep staying home as much as possible.
Yeah, I am literally at home. I have not left in 10 days. I'm looking forward to extended periods of sunshine.
Are you like looking out of your windows and just thinking about, I remember
like a house cat. Yeah, like a house cat. Like,
that's what outside looks like.
I remember you.
Yeah, no, I mean, I've been fortunate to go out in the backyard from time to time, but no, my face has missed the sun. Yeah. I need to be getting out there more. But that's the problem when you work from home.
Gotcha. You'll make it through. We're going to make it through this.
I know. You too, buddy. Thank you so much for your time, and thank you to all of our listeners and viewers out there.
Thank you guys so much. We'll see you the next time. Be sure to follow us online at www.hillsyoungdims.com or at hillsyoungdims. I'm Quentin Torbert. This is Jason Marlow. We'll see you guys next time.
Y'all take care.